Sandra,
Hi, Greg.
how
Thanks
are
for
you?
class this weekend.
Oh, good. I'm glad you enjoyed.
Yeah, I did, but I have a lot of questions.
Yeah, I'd love to
Uh,
answer 'em.
well, the first one is about my husband. He had open heart surgery about 2 years ago, and he physically has not been the same. He had a mitral valve replaced, and he had a maze procedure, which
Right.
is supposed to do away with uh,
Yeah.
AFib. And he's always been an exerciser and he still exercises every day, but he has all of these symptoms that you have
Which are what? What are the symptoms?
um, reduced exercise capacity, shortness of breath, fluid retention, in risk, increased risk of arrhythmias.
Oh, did we put that in the newsletter? Was that the cardiac
No,
fatigue? Right.
this was in the
In the weekend.
yeah,
Okay.
yeah.
Yeah.
And also he feels he has a poor quality of life. And I think he probably does because he can't do what he always did.
Yeah, he
So,
doesn't feel good and he doesn't have energy to do it. And
yeah,
he starts to do something and probably has to stop himself. And yeah.
yeah. So he's not taking it well, really well, but I'm not sure I would either. But I was wondering about oils. You had mentioned camphor and rosemary camphor as being really important, but I understood that rosemary can raise your blood pressure. Is that true?
It can a little bit. In some cases, it actually will lower blood pressure. It's not rosemary, it's actually rosemary camphor, which is a different chemotype than regular rosemary or rosemary verbenin. It's usually only used for cardiovascular issues or things to do with like cholesterol and things like that. Um, with cardiac fatigue, um, I tend to do a rotation of a few things, like I like to use Anula, I like to use Lang Lang, I like to use Melissa. Um, I usually have the person put 6-8 drops of camphor on their wrist, like daily, and they
Uh-huh.
don't have to do them all the same day. But
Okay.
like what I like to do is like every day you're putting camphor on your wrists and then you're using one of the oils and you're rotating. And at first they might only want to do one, but really more severe cases, uh, like I usually have them kind of rotate through.
Mm.
And I've even been doing a thing with trying to treat um like chronic blood pressure with going through and doing this.
Mm.
And it's helping, it's working. Like it's not completely getting it to where I'd like the blood pressure to be, but it's dropping it down low enough to where they're in like high normal range, but I'd like to still even get it down a little bit lower. So we're playing with some different little protocols. So I'd like to be able to present to you guys like a protocol that it's going to be a little bit involved, but that you're able to treat a lot of different forms of blood pressure issues with just like a simple template. And uh given what he's gone through, I would say he has substantial cardiac fatigue. And you could start with just like him inhaling Anula if he's wanting. You could do the Lang Lang body tonic on him a little bit, put
Okay.
camphor on him, and then I still would probably have him take like Melissa or Neroli or Lang Lang internally, just like 2 or 3 drops a day, in that combination. And, it's not going to happen overnight, but over a period of time, the shortness of breath gets better. It still might be there when he really climbs some stairs or exerts himself, but still his ability to get there is stronger. And if then he becomes more active, that also kind of helps. The other thing that I would say is usually I have them take coenzyme Q10.
He's been
Or you
taking it
Yeah, like
for a
how
couple of
many
years.
How many capsules do you think he takes?
Oh, I don't know. It's a
I
pretty
would
high dose, but I think he takes one.
I would probably bump it up to like 3. Like,
Okay.
you don't have to do it overnight, like bump
Mhm.
it up to 2 for a little bit and then even up to 3. But I know several doctors that they'll say like anytime there's a vascular issue, if there's congestive heart failure, even high blood pressure, that's kind of a go-to supplement. Putting them on. Ubiquinol is a little bit more
He takes that too.
yeah, ubiquinol is a little
Yeah,
bit more like
yeah,
the
that's what
body
he
is able
takes.
to use it better than just regular coenzyme
Yeah.
Q10. It's a form of it. And so with all of that over a period of time, that I mean, he's had a surgery and stuff on that area, but that should be relatively helpful for all of that. And as he's able to get more active, that should shift it and change it. I mean, there's been a few times where that has not happened when I've treated them, but most times they do become more active. Their energy levels come up and the mood will shift a little bit, but it's consistent treatment over a period of time.
Okay.
Yeah.
Thank you. Can I ask